Taija, how are you doing?
I'm good, thanks.
I'm so excited to have you here on the podcast today. But before we get started, I want to tell everybody about the connection that you and I have and how
Okay.
we actually met. Is that cool?
Yeah, for sure.
Cool story. So, for those just tuning in for the first time on this episode, my big brother Corey passed away October of last year of a fentanyl drug overdose. And somebody on Instagram, who I don't know, reached out to me and let me know that this professor out in BC was putting together a documentary on the opioid crisis and how it's impacting families. And so, yeah, I was all on board for reaching out to them and saying, yeah, I'd like to be a part of this. And then told me that we had to interview another person and as part of the process. And I was matched up with this lady who ended up not showing up or wanting to do it anymore. And then I was paired with Taija. And both of us were super nervous, right?
Oh, yeah.
super
Yeah,
nervous. But as soon as we started talking, that all went away. Like
definitely.
instantly. And I was so comfortable sharing such a hard story with Taija and how you held me in such a safe space. And it was just something really cool to experience with you on such a hard topic. And now you and I would consider you one of my friends.
I
And
know, isn't it strange?
it's such a cool world. I love it.
Yeah,
Love it. So that's
yeah.
where I met Taija and how I found out part of your story and what you shared in that documentary. But it was actually in April when I went out to Victoria, where I was doing some market research and talking with you more about stuff that you're doing in this space, and where I knew I really wanted to have you on my podcast so that we could shine a light on some of the stuff going on in our country, anyway, in Canada, in regards to the opioid crisis and just the drug situation in general. But before we get there, let's hear a little bit about you and your story, and then we'll get more into it.
Oh boy, I don't really know where to begin. I guess I live in BC and I'm a mom of two boys. And my journey in all of this started in 2011. Sorry, I don't know. I feel so nervous.
Don't be nervous.
I was in a car accident, which is a typical story for a lot of people where they get injured and they get prescribed. That led to 4 years of prescribed substance misuse. And then to the point where I was also like purchasing on the side over and above what my doctors were prescribing me. There was lots of times when my family didn't know, and I really didn't know how else to get help besides going to a 12-step program, which I had done a few times. And then, went to treatment, completed a program. And then the 12-step, although essentially saved like my life, it was never really enough for me. I was always like the why kid. If someone said, this is red, I'm like, yeah, but what makes red? Like, how many colors do you have to put together to get this hue of red? There's so many shades of red. What do you mean?
Yeah.
So essentially I got myself into a lot of trouble, but I also learned a lot along the way.
Yeah.
Yeah. My mom always says I like to take the scenic route.
But the scenic route shows you a whole bunch of things.
It does. And I wouldn't change it. I wouldn't change a thing. I mean, I went through a period of time where I lost custody of my children. I lost even as simple as access to my mom's house. One of my like biggest accomplishments through all of this was getting a key to my sister's house, which I think I've mentioned that before when we've talked, is I like still see her today. And it's, 3.5 years later where I'm like, I'll open the door.
I have a key to a house.
Yeah. That's such a simple thing, but it was a huge accomplishment. Yeah. And so I guess just getting back to the why part of it, treatment was incredible. It was what I needed. And the type of treatment that I received was extremely hard. And it was, I guess I just learned how to just take a step back. But then when I left treatment after like I completed their 90-day program, I still was left with, what do you mean if I ever use again, I'm gonna die? And that, not saying that that doesn't work. So this is what I'm speaking to is just like my own personal experience. You know, I know others feel differently, and that's okay too.
Yeah.
And so what I dove into was the community action team in the community that I was living in. I was met by this new woman who, she came in and she just like ran a train over this community in such a beautiful way. She never took no for an answer. She came from a ton of experience in the downtown east side, and I just was
Downtown
like
east side, meaning
oh,
Vancouver, right?
Vancouver, sorry.
Yeah.
Yeah.
Yeah. Where there is a substantial crisis.
Yeah. Oh yeah.
Mm-hmm.
And a lot of overworked, underpaid, understaffed people fighting for this major crisis that has been going on for a long time. And so since 2016, since this has been announced, the issues stem back further than that. But what I've noticed is this divide between the fact that this is like a health issue and not like a criminal one. And the more that we continue to go and enforce and police this issue, it continues to add to situations that, you know, your brother ended up in, and my cousin, and like countless lives. But unfortunately, addressing this issue in the ways that I feel, and that I think that most people do when they understand what's going on, is there's no money in it. And that's
there's no money allocated, real money allocated to handling and supporting and dealing with this crisis in ways that work, is how I understand it.
Yeah, and I think in turn, even if they did put money into it, this is going to take a long time to heal and to address. And I think what continues to add to it is, you know, the general public sees us throwing money at this issue in these small efforts, which are destined to fail, but it will continue someone's political career. And we are not a long game country right now. We are
short-term fix.
Yeah. And self, the words I'm looking for, that really, I think at the end of the day, the people that are making these decisions, it's within like their own self-interest. It's like, we are a populist vote country. So if a decision is going to further someone's career, regardless of the harm that it's going to cause to the people beneath them, it's not really going to affect them, because they're going to make their money and they're going to make their political gains, and then they're dead. So it doesn't matter. We're very individualized in that way.
What are some of the things? So back to this lady that you were talking about, what has she done that you've seen in your community, and how that's impacting people?
You know, I don't really know like many specifics. What I do know is that after she had come, she coordinated the community action team, and I saw a lot of things kind of snowball after that. Our supportive housing, became successful, and she ran the shelter there, and she just seemed to come up with these funds that provided these resources. And she gave people like me that don't have a post-secondary education a chance. And so I think she provided a lot of opportunity, and now that community is leading the way in a lot of big changes with like nurses prescribing, overdose outreach teams, and then safe consumption sites. There's a safe smoking site that they have there now. And yeah, I think they just really foster what works. And I think it started with her.
And are you comfortable naming her?
I didn't ask her
Okay.
if I could name her. So like I do, but I also do a lot of things impulsively. So yeah, if I had her permission, I definitely would
Okay. Yeah. No, you
say,
don't
and
have
I'm
to.
sure she'd be fine with it, but
Yeah.
you just never know.
Yeah, you never know. And
Yeah.
all that we'll say is she's doing good work and inspiring other people, right?
I am who I am in this field because of her, for sure. That like chokes me up.
It's beautiful though. Like it literally, you never know who you're going to impact, right? Even with one person and impacting one person's life. Now look what you get to do with your life. You get to be there for your boys, right?
Yeah, for sure.
So it it literally takes sometimes just one person reaching one other person to make a huge difference. So that's all we need.
Yeah.
So what are some of the things that you've seen, because you've worked in outreach over the last how many years? Couple of years?
Since 2019.
2019. What are some of the things that you're seeing that are working with in the outreach program?
Some of the biggest things I think work and that I see work is dismantling this model of telling people what they need, approaching people in a way of asking them what they need, and taking like this system of abstinence out of it. I think what works is like truly meeting people where they're at and just understanding that like they're people, they're just human, and they're in such a state of like crisis. Some, not all, some people just like to use drugs and live outside, and that's cool too. But understanding that this is a health issue, and that just because someone uses drugs, and maybe that's why they're in the situation that they're in, that doesn't mean that they also deserve to be mistreated in a hospital setting. And that doesn't mean that they don't deserve to have clean supplies or a safe supply of drugs. Or, I compare it to like my grandpa. My grandpa died of lung cancer. He also drank a case of Lucky every day and smoked 2 packs of cigarettes. And when I tell people that, no one has ever said to me, "Oh, well, he deserved to die."
Exactly.
Like, why didn't we just get him to source his own cigarettes? We didn't take those away from him. It's a regulated supply of drugs. Same with his Lucky. And so, yeah.
That is a really good way of putting it, Taija, because it's true. Like there's a little bit of hypocrisy in it, right? Where the things that are very regulated, like smokes and alcohol, nobody ever says just take that away right away, right? There's usually a process involved in that as well, where you wean off of it or you put a patch on your arm or whatever, right? There's a process of getting off of it. So why is there a just stop using drugs mentality? There's a process to recovery.
Because, well, I guess in my own opinion, it's really hard to let go of an idea that we've held on to for so long, the just say no to drugs, which is bananas. Like, I don't think that is a rational thing to say to any young person who does not have that rational part of their brain developed. This is why when we're young, we do dumb things,
Mhm.
because that's how we learn and that's how we grow. So instead of approaching it in a way of educating people and letting them make their own decisions, because they're going to do what they want to do anyways, we just want to stop them from doing something. We want to keep that narrative going. And granted, like, all of these things are changing, but at a very like snail's pace. And I like to believe that there are more people that understand this from a health issue and from a harm reduction stance. But where it ends up is in the hands like of our government that make these decisions based on something that they don't understand.
Mhm. So what's your thoughts on how we make them understand more so that these funds can be allocated where they need to be?
You know, our local MP has been advocating for this bill that he put forth, Bill C-216, and it was so beautiful to watch him in his last reading of it, and where he challenged other leaders from, all the provinces and all those who were making the vote. One of the things that stood out for me is he said, even if you don't agree with something, then bring it to a committee. Come and let's have a conversation, because it's okay that you don't agree with me, and let's make some changes. Let's make some radical changes to make a difference in what's going on in these people's lives. We don't have enough gorgeons as leaders, and we have more of our health ministers. So the day before Bill C-216 was voted on as May 31st, and that's the day that they announced our decriminalization of 2.5 grams, which is a joke because the recommended was 4.5, and even that was a low ball when looking at like the people that need to be helped. And I don't find it to just be a coincidence that they announced this decriminalization the day before that this bill was going to be voted on. I think it was intentional. Or health minister, they said that they are not going to support this bill going forward. And when they made these decisions around decriminalizing some illicit substances up to 2.5 grams, they didn't go by all the information from healthcare providers and, health workers and social workers and outreach workers. They didn't go by the people that are like in the trenches. And
Who did they?
So they went by the threshold of 2.5 grams, going by the data provided by our law enforcement and what was typically seized, which was
That makes no sense.
No, it doesn't. What'll typically happen to someone is that, so let's say a point costs $20 for someone.
Mhm.
But if they buy a ball, they're going to get it for $10 a point. So they're going to go out and they're going to buy a ball. If you're on income assistance, or if you're on PWD, or if you're just hustling, I mean, I'm couponing these days.
Mhm.
Like, times are really hard right now, and you're going to get the most bang for your buck. And more often than not, from what I've seen, these folks will get, pulled over. They've just picked up. The officer will seize the drugs, and that's it. They won't arrest this person. They won't give them a fine. They won't, nothing. They seize the drugs. So to say that the average seized is like 1.9, maybe that's what's written down.
Good point. Yeah, good point. So they haven't actually, in this decriminalization, from what you know, they have not actually taken the advice of the people in the trenches every day dealing with it.
Yeah, no, not even a little bit.
What would the
Uh,
people that are in the trenches say needed to be done in that regard?
there's a lot of conversation around that now, especially with Mom Stop the Harm. And I think from what I understand is that there is a huge disappointment within these communities. This does not help us. This is providing our law enforcement with some training over the next 7 months. I'm not sure what that looks like. I'm hoping there's going to be some more education, but I just find it just another coincidence that we are putting more funds into enforcement and making it look like education.
And not in the actual treatment or helping the people in the trenches every day with
Yeah.
what they need. What do they need? What do the people every day in the outreach programs, and what do you think they need, especially in the rural and remote communities?
We need to, I think, just to start getting loud. We just went through this pandemic of very strong, loud opinions on like vax and anti-vax, and you witness some huge moves be made in that. And we need that same sort of support from our government as they gave to COVID-19 and that crisis. We need that same drive. We need more people who are going to be able to make a difference in these communities, stand up and say things like, it's okay that we don't agree, but this is how we're going to move forward because this is in the best interest of like our country and its citizens. And we need less of someone's personal interests.
I agree.
And changing the narrative and changing the discussion around, I don't know, things that just lead to more stigma. Because what this is going to do, this decriminalization of a small amount, is allow recreational users essentially not to have a criminal record. So we're not, fighting to legalize all drugs. That, from my perspective anyways, there still needs to be consequences for breaking the law. I don't think that addressing, the recreational and general public in this issue is the solution to the problem. I think what we needed to do was not criminalize people who are dying and suffering. And there's no change.
Well, and let's circle back to your story and the fact that you didn't go out looking for these drugs. You were prescribed legally an opioid for pain management for a car accident, right? And if you've seen Dope Sick or if you've seen other documentaries out there, you see how quickly that can spiral. And is that how it happened for you? Was it a quick spiral?
100%. It was like, I just resonated with that series Dope Sick so hard because it works. It makes you feel great. You don't feel any pain. And I worked 2 jobs and I've always put a million things on my plate. And so once I was introduced to that, I was like, this is fantastic. And it worked really well until my tolerance grew, and then I needed more and I needed more. And it changes the way that you think. It when I think about the decisions that I made and the things that I did in that time in my life, I just, it's, yeah, it's, I don't recognize that person. It was just this constant state of, if I don't take this, I'm going to die, which is like in a rational way of thinking about it. It's really the opposite. If you keep taking this, you're going to die. And
but it's how the drugs actually, when you're not filling those pockets, those receptors, it's making you feel like you are going to die if you don't have it, right?
Yeah.
So to go from not using to being in a car accident to taking it, was it oxy in your case?
I eventually, yeah,
to not being able to function without it. And this is happening to millions of people, people that you would never expect that it would happen to them. And it's not something that they wanted to happen in their lives. And that's why we need to recognize that they're people that just need help.
Yeah, I recall this one hospital visit I had, and this is me walking into a hospital as a middle-class white female. I had an average childhood. I try to remember the place of privilege that I come from. So when I reflect on how impossible it was to get to that final round of treatment, I was recalling that hospital visit where I was in like a significant amount of pain. I was T-boned through an intersection. My truck was wrapped around a pole. It was terrible. And so I went into the hospital, and it was that my whole body was just like so seized. And the doctor, when I had told him what I had been prescribed, and then immediately goes and like checks my history and looks at my chart, and of course there's a history of like substance use there. And he came back and said, well, I can give you Motrin. And I just thought, you don't think I tried that? And I'm immediately met with shame, and that I don't deserve to have someone treat me in like the state that I'm in. And we are just in a place now where it's so far beyond that, because at least I was on a regulated supply at that time, taking oxys, and now people are going into the hospital with these same health issues, and there's not even a chance that they'll receive the drug that they're on.
Yeah. There is so much work to do, Taija, so much work to do. And what do you think, besides getting really loud, what do you think the next step is for people like me and you to do to make an impact in this situation?
You know, I have two versions of that. There is the side of me that wants to stay rational, stay respectful. Maybe that just comes from being a woman. Keep your composure.
Keep your
smile.
composure. Yeah.
Don't look crazy. But the other side of me just thinks, fuck that.
Yeah.
You
get
know,
loud and get mad.
I want to ask hard questions. I encourage more people to pay more attention and to ask those hard questions, and to not be afraid to hurt someone's feelings. You know, that's the world that we live in. Don't rock the boat, and don't say the wrong thing, or don't make the wrong move. I don't know. I feel like there's a lot of accountability put on individuals to hold other people and their feelings and be responsible for them. And that is not going to fit in this narrative. Start, talking to your local MP and start asking hard questions and do it openly.
Mm-hmm. Mm-hmm.
And
Yep.
and don't be afraid of the backlash. I mean, I'm not in politics, so I am not looking out for my career in that sense. And I'm not afraid to hurt someone's feelings, and I am not afraid to ask hard questions. I've fallen on my own face and gotten in my own way so many times that I know what I can survive. And I think that until we remove politics from these decisions and start bringing more light to it, that's the only way that things are going to be different.
Mm-hmm. Absolutely. Well, that's why this is my way, this podcast, one of my ways of asking questions and shining light on it. And I definitely have other plans as well to get loud, ask questions,
Mm-hmm.
and just make a difference, right? So
Yeah, and don't take, when the answer is these things take time. No, they don't.
mm-mm,
Look at all the things that changed in the last 2 years that didn't take any time at all. How many times did our mandates change within weeks? Every 2 weeks, something was different.
mm-hmm. It's a very good
So
point. Sometimes it
start,
was almost every day.
yeah, and so start questioning that
Mm-hmm,
when someone says these things take time. No, they don't.
mm-mm,
It just
no,
depends on what they're going to gain.
mm-hmm,
So,
mm-hmm,
and it's important. A lot of things have changed in our country. And I mean, just like before we finish, there was this one mom that stood up. I think, if I'm remembering it correctly, when they were voting on the bill that obviously failed, and just to speak to residents of Alberta, I think
mm-hmm,
what she had said was, why are the lives of people in BC more important than the ones in Alberta
mm-hmm,
and every other province? And I just thought that hit me so hard. And it's just one more thing to question is, why are we being separated, and why are we being pitted against each other? Because although some people might be really happy for our province, there are still going to be people who are going to resent that. So now what are we going to do? Start living like in the States, where all these states are divided? That's not who we are as
mm-mm,
people.
mm-mm. No, we're better together, like collectively, and not pitting against each other in anything, let alone the drug crisis, right? So absolutely. I heard about that story too, and it's true. We should not be doing it in one province and not other provinces, because then you do have that division right away.
Yeah.
Right. So thank you,
Yeah.
Taija. Honestly, thank you for your time and your thoughts on all of this. And we definitely need so many things to change and be improved upon. There's way too many people dying. It's happening so much, and it's talking with people like you that have actually experienced it. I have not experienced the use of opioids or had an addiction in that way, but I obviously had my brother and I watched him struggle with it for years. And I want to remind everybody that Taija is a real person with a family, with a mom, with the dad, with kids, my brother, same thing. And all that they want is to live a normal life, whatever normal is for them, where they feel like they are loved.
Yeah, you nailed it. Yeah,
Right?
you just want to be able to get help and not feel ashamed or
Mhm.
feel unsafe trying to get that help. Yeah, just continue to change the narrative and the conversation.
Mhm. Today, I am grateful for this time with you and how the universe freaking works because I am just so grateful that that documentary led me to you and now our friendship. What are you grateful for today?
I am so grateful for this platform that you have grown, and how today was just such a beautiful reminder of where I came from, why I do this, and that I love myself for being the why kid.
Oh,
I
I have
forget that sometimes.
goosebumps. I have goosebumps. I really do. And that means that you are on the right path and don't ever, ever stop being that why kid ever. Because you know what?
I
When you're the
can't.
why kid, your kids are going to be the why kids as well.
Mhm.
And that
Well,
is
they are.
so beautiful. Keep having them be why kids because the more why kids and why adults, the more we're going to make some changes, right?
Mhm.
So thank
Thank
you
you.
again for your time today. I'm really grateful.
Same.